Joining me now, Dr. David Shiner. He's President Obama's former doctor, a member of Physicians for a National Health Program. Doctor, good to see you again. And Kevin Hassett, Director of Economic Policy Studies at the American Enterprise Institute. Kevin, good to have you here. Let's begin, Dr. Shiner. Obamacare is not the answer, it's the law. The Republicans made a big deal about repealing Obamacare. That doesn't look like that's going to happen, at least not to me. Does it you?
Well, I hope not. Obamacare is far from satisfactory. It's not what I wanted. I wanted something much more pervasive throughout our country. I didn't want the preservation of the present private health insurance, which costs, just the administration of private health insurance is $400 billion a year, and in his program, the insurance companies stay the way it is. On the other hand, if we eliminated it, in 2014, 30 million people will be added to having health insurance. Right now, because of lack of health insurance, 50,000 Americans die every year from lack of health insurance. Between now and the enactment of the law, we will have had 200,000 American deaths. Every year, it's 16 9/11s from lack of health insurance. So while his program is not a good law, I think to eliminate it would be foolhardy.
Kevin, those are dramatic numbers that the doctor has just cited. I mean, extraordinary numbers. Do you disagree with those numbers at all, or is that
well, you know, I haven't fact-checked those numbers, but it's absolutely correct. You know, as Americans, as compassionate Americans, we need to make sure that everybody has access to health care. The problem is that President Obama passed this health care bill, and they really sold it as something that was going to bend the cost curve and move us in the right direction. But what they really did is they took a bunch of savings that we all knew about and then channeled them towards other programs. And so what we see is, like yesterday we had the S&P warning that the U.S. deficit situation is a threat to our bond rating. That happened because the health care bill didn't really address the fundamental problems. And that's why people like Paul Ryan are coming out with new and innovative solutions that I think do a much better job of moving us in the right direction.
Dr. Shiner, do you have a view on Congressman Ryan's dealing with his plan to deal with Medicare?
Medicare is a program that works. About 80% of my patients are on Medicare. I'm very happy with Medicare. Medicare, the government never interferes in my practice. Private insurance companies are constantly preventing me from giving adequate services. Medicare has eliminated a lot of the debt in older people over 65. Medicare has worked. Their overhead is about 3 to 4% a year. Private health insurance has an overhead of close to 12 to 20% a year. Medicare works. To eliminate Medicare, I think, is foolish. We need Medicare for everybody. And the problem with funding Medicare is because it's now taking care of elderly and ill people. If everybody subscribed to Medicare, if everyone had a Medicare card, you'd be younger people would be putting money into it, and the system would be far more solvent. And just the savings on not having private health insurance would more than cover the uninsured now. And with his bill, his law, there's still going to be tens of millions uncovered.
Kevin, Dr. Shiner makes a compelling case.
No, I disagree. I mean, certainly it would work to move people around to give everybody a fancy new car. The fact is that Medicare is far too expensive. We can't afford Medicare going forward. You know, there are tens of trillions of dollars of shortfalls coming if we don't try to change it. And one of the problems with Medicare is that people don't really have skin in the game. People don't have to put money out of pocket when they're getting that first visit. And because of that, there's a big increase in demand for health services. There's also very poor cost controls. And so right now, Medicare, you know, maybe it's serving the population that's seeking health care right now adequately, but the problem is that we can't afford it going forward. And so President Obama's solution is to appoint this independent advisory council that's going to start setting prices and rationing care. That's his solution to the tens of trillions of dollars of shortfall. Paul Ryan has a different plan that relies on competition between health insurers to give people a plan that they like. If they don't like it, they'll switch to another insurer. And so I think that going forward, the problem is that Medicare can't be sustained at current tax rates. We'd have to double tax rates at least to fund it going forward. And President Obama's health care plan failed because it didn't really address the problem. And the S&P's the fair referee, and they gave us an F yesterday.
Now, that F, by the way, we should, in all fairness, point out, is on a lot of administrations, on a lot of Congresses, and a lot of really pathetic programs that have been created by this government, certainly not just simply on Medicare. But Kevin does make the essential point, which is Dr. Shiner, that we simply cannot afford Medicare as a nation. And the other entitlements, which now amount to over $110 trillion in unfunded liabilities, what do we do?
Well, when you look at the present health system with Medicare and with private health insurance, the United States now ranks about 37th in the world. Our average spending per capita is twice as much as the closest country to us. So the question, there can be adjustments in Medicare. There's no question there's a lot of wasted money, tremendous wasted money. Tort reform, now they minimize that.
But I understand. By the way, in per capita cost, the closest countries, I mean, some of the most elaborate single-payer systems, universal coverage, I mean, they're significantly better than that of the United States, at least as, you know, in providing broad care. But they aren't of the same quality. It's a different system, and it becomes a real issue. We understand.
I differ with it. No, quality.
We understand we're paying a lot of money for the care that we have. The issue is we can't continue to pay at these levels. $110 trillion in unfunded liabilities is going to come down on our heads like a ton of bricks.
Well, first of all, the quality is not as good as you say, because, as I said, we rank 37th. Slovenia is ahead of us. There is no question.
Okay. All right, Doctor, I don't want to get into a silly argument on quality of care. The care here is pretty good. Can we agree with that? The care in Holland
37th best in the world.
Okay, Doctor. I would love to continue the conversation, but I think we've sort of reached the end of this particular rope. It's great to have you with us. Thank you so much. Kevin Hassett, thank you as well. Dr. David Shiner, thank you. If you've got a question or a comment about the future of Obamacare, Medicare, or any other care, just send us an email. Email me at lou@loudobbs.com.